Flucytosine, also known as Ancobon, is a medication used to treat serious fungal infections in the body. It is classified as an antifungal drug and is commonly used in combination with other medications. Flucytosine works by slowing the growth of certain types of fungus. The recommended daily dosage and optimal timing for taking this medication should be determined by a healthcare professional based on individual medical conditions and needs. When taking Ancobon, it is important to follow your doctor's instructions. Usually, you will need to take this medication 4 times a day, spaced out every 6 hours. To minimize stomach upset, it's best not to swallow all of the capsules for one dose at the same time. Instead, you may want to take the capsules for each dose over a 15-minute period until the full dose is taken. The dosage of Ancobon is determined based on your medical condition, weight, and response to treatment. It's important to take this medication at evenly spaced intervals to keep the amount of the drug in your body at a constant level. To help you remember, take it at the same times each day. It's crucial to continue taking Ancobon until the full prescribed amount is finished, even if your symptoms disappear after a few days. If you stop the medication too early, it may result in a return of the infection. If your condition lasts or gets worse, be sure to contact your doctor right away. If you experience nausea, vomiting, or diarrhea while taking Ancobon, you can try to reduce stomach upset by following the instructions in the How to Use section. If these effects persist or worsen, it's important to notify your doctor or pharmacist right away. It's essential to remember that your doctor has prescribed this medication because they have determined that the benefits outweigh the potential risks of side effects. Many people who use Ancobon do not experience serious side effects. However, it's important to seek medical attention if you experience any serious side effects, such as signs of kidney or liver problems, anemia, infection, bleeding, or muscle weakness. Although rare, a serious allergic reaction to Ancobon may occur. If you notice symptoms such as rash, swelling, severe dizziness, or trouble breathing, seek immediate medical help. This is not a complete list of possible side effects, so if you notice any other effects not mentioned here, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. If you have kidney problems, it is important to use Ancobon with caution. This medication may cause decreased kidney function and liver problems, as well as decreased bone marrow function. This serious side effect can lead to a low number of blood cells, including red cells, white cells, and platelets. This can result in anemia, decreased ability to fight infection, and bleeding problems. Your doctor will monitor your kidney, liver, and blood tests and adjust your treatment to reduce the risk of these side effects. It is important to follow your doctor's instructions carefully. Before taking Ancobon, make sure to inform your doctor or pharmacist about any allergies you may have, as well as any medical history of kidney problems, liver problems, or decreased bone marrow function. This medication may increase your risk of getting infections or making current infections worse, so it's important to stay away from anyone who may have an infection. Discuss any recent exposure to infections with your doctor. It's also important to talk to your healthcare professional before getting any immunizations or vaccinations while using Ancobon, and to avoid contact with people who have recently received live vaccines. Use caution with sharp objects and avoid activities that may cause injury. If you are pregnant or breastfeeding, discuss the risks and benefits of using Ancobon with your doctor. Drug interactions can change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Ancobon are cytarabine, other drugs that may affect the kidneys, other drugs that decrease bone marrow function or lower your number of blood cells, or weaken the immune system. Ancobon may also interfere with certain lab tests, so it's important to make sure lab personnel and all your doctors know you're using this drug. Remember to consult with your doctor about the best time to take this medication and the proper dosage for your specific condition. If someone has taken too much Ancobon and is experiencing severe symptoms such as fainting or difficulty breathing, it is important to seek medical help immediately by calling 911. Alternatively, you can contact a poison control center for assistance. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, residents can call a provincial poison control center for guidance. It's important not to share Ancobon with others. While taking this medication, you may need to have lab or medical tests to check your kidney and liver function, blood cell counts, and blood mineral levels. Make sure to keep all your medical and lab appointments and consult your doctor for more details. If you happen to miss a dose of Ancobon, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular dosing schedule. Do not take a double dose to make up for the missed one. It's important to store Ancobon at room temperature, away from light and moisture. Make sure to keep it out of the bathroom and away from children and pets. When it's expired or no longer needed, be sure to properly discard it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. Avoid flushing the medication down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.